Hello, I'm Bozada. I'm here at Hosmer Chiropractic Health today to discuss another variation of our deep squat mobility. We're going to use a band adaptation here. What this is going to allow us to do is more comfortably get into the squat because it's going to give us somewhat of a spot or assistance down into that position. It's going to allow us to execute a perfect squat, and then from there we're also going to have the balance assistance to then move into some ankle mobility, which is also a big fault and kind of overlooked issue for general mobility in the squats, and especially the overhead squat. Most people are concerned with the spine and the hips. Those are also things to worry about, but also whether or not the ankles are flexible enough to maintain this position is another thing. So sometimes we get ankle collapsing, heels coming off the floor. Those are all things that can be worked out with some ankle mobility. So we set this up in a position that the band anchor point is higher slightly than my hip height when I'm squatting. We will then step in. You want to place the band right at about low glute level, right at the cheek line. Okay, this is important because if we go any lower, the band will tend to go down to the knee. If we go any higher, it'll go to the upper back. So we want to then stay low, partial squat, drive the hips back, heels down, get into your squat. So from this position, I've got my chest up, my shoulder blades down, heels down, knees out, ribs pressed down. And from here, what I can do is I can join my hands together and I can transition my hips out. I'm going to keep my heels down as my ankles glide out with my hips. And I'm going to get some Achilles tendon, internal and external work on the ankle joint. Flossing side to side. I can also move more in and then press out to where I'm almost sitting down on the floor, coming back up, kind of some transitional hip mobility here. I can sit down to the right, keeping that ankle down, back to the center, sit down to the left, keep that ankle down, right back to the top. Okay, from here we can also add from our other 3 videos the pressing of the hip, away. Okay, we can also do that with the elbows to start, or one knee at a time. Okay, we can also add some rotation to this movement. Okay, and we can also add PVC work where we have overhead squats, SOTS presses, pass-throughs, everything from this mobile position. Okay, from here we can also kind of sit back, let the elbow drop, let the shoulder blades raise, come back up, drop to the other side, reach, back up. So now we're getting some dynamic spinal mobilization as well. And this should all really help you with your squat mobility. Thanks for watching. Enjoy.